Good afternoon, everyone. Thank you for joining us. I am here with Lauren Whickerath. We are currently in beautiful Ellensburg, Washington. We are at Gerald's, and this is our weekly Facebook Live event. And today we have sort of a more somber subject, and what we are here to discuss is Overdose Awareness Day.
Yes, International Overdose Awareness is celebrated across the world on August 31st, and we are celebrating it here, commemorating it on August 30th, the day before, on this next Tuesday. That's tomorrow.
Next tomorrow.
This is tomorrow. Yeah. Mainly because the setting of where we're holding it is very vibrant on a Tuesday afternoon. We wanted to make as many facilities and services open to share.
And it gets complicated with rodeo and things like
Yes.
that. So I'm just going to hold up the flyer for the event, and this is complicated, isn't it? And just reading some of the statistics from Kidatas County is heart-wrenching. We've lost 10 people last year, in essence, January 10th, basically in a year and a half or so, to substance abuse disorder and overdoses. That's here in our county. This isn't somewhere else. This affects, and we've all read it in the paper, and we all know somebody who's been affected by this, whether it's resulted in death or not. This is a big deal.
It is. The fentanyl crisis, the fentanyl has just made it a deathly situation, and it's across the nation, across the world. But I believe 2,000 overdose deaths occurred in Washington State, and then, as you said, 10, and I believe 22.
Yeah, 22
responses to overdoses
right.
in our county. It's just a very scary time to be using any kind of drug that is not made from your respected pharmacist.
Yeah. And prescribed, of course.
And prescribed.
And I should just back up and mention that Lauren is the harm reduction specialist for the Kidatas County Health Department. And thank you. Well, I really appreciate you bringing this up to us and coming and talking to us, because this is one of the subjects that people don't necessarily want to discuss. And I think that's part of the problem, is it needs to be discussed more. And so again, this is tomorrow from 1 to 4 at the United Methodist Church. So this is right across from the library.
Yes.
And everyone is welcome.
Everyone is welcome. It's from 1 to 4 p.m. We have music that will be starting right at 1 o'clock. We have speakers. We have law enforcement. We have physicians that treat substance use disorder and have been living and treating this issue for many years. We have other agencies supporting recovery and mental health, local fish and apoyo. I mean, the list, there's many agencies that will be there representing their what they have to offer and support. But we have quite a lineup of speakers, and we have art activities. This event, we want to respect those that have been lost and those that they left behind, that are still really in a lot of pain, and using art therapy. Nan Doolittle has an art therapy nonprofit that is also housed in the courtyard of the Methodist Church, and she will be offering some, making a bead bracelet, and then we have a canvas with acrylic. Thanks to Gerald's that's supplying the art supplies for both of these activities. It's very, very therapeutic, and it's very helpful to be engrossed in art, and we're hoping that this canvas, everybody, my goal is that every single person that comes will, even if it's just one little dot, will add something to the canvas, and then it can be displayed. But it's not really the product, it's more the process.
And so who is this for? Who should participate?
This is for everyone. We have, I feel like we have something for everyone. I think a lot of people don't realize what a big problem and danger this is to all of us.
So it's a great way for people to become educated in the issue.
To educate, we also, with support from the Department of Health, we have extra doses of Nasal Narcan, which is a life-saving overdose medication. If somebody accidentally or intentionally takes an opioid product, they can overdose, and this will knock off it's just a nasal spray as if you were taking allergy medication, and it will, somebody else has to give it to you if you're the one overdosing, but it will knock off the receptors, and immediately you will be out of the overdose situation, if it is indeed an opiate overdose. So
And
this is a real game changer to have.
That's what our first responders are using
Yes.
and administering when they
Yes,
run into
they have this.
situations.
It's also an injectable form, and we have these at, we will have them to distribute for free at the.
And so who should have that available? I mean, you told a great story, and actually, if you don't mind, I would love to have you share that again about if you can, about the concert.
I am at the courtyard of the church on Tuesdays and Thursdays, where we have a room, harm reduction room, and we, from 8 to 5, we're there, and if somebody wants to come in and get Narcan or other harm reduction supplies, we're there. We had someone come in a couple weeks ago, 2 girls that were actually from Idaho. They were going to a concert somewhere in the area, and they said that they had been the day before, or they had been to, I'm not sure if it was one of those 3-day events, but the artist stopped in the middle of the concert and told everybody that they should be aware of harm reduction, that everybody should carry nasal Narcan or a Narcan product that can save the life of somebody that they may come upon that's in an overdose state. So these girls went to our local pharmacist, I guess on their way to the concert, Rite Aid, I believe it was, and I wanted to shout out to Rite Aid Pharmacy, who sold them one, and they said it was approximately $80 to buy it. They must not have had insurance that covered it. Many insurances cover it 100%. Apple, Medicaid will cover this 100%. Others partially, but theirs, they paid $80. But that pharmacist sent them to us. They knew that we existed, and we were able to send them with, I think I gave them 8 because they were going to be with other people. We wanted them to spread them out, because if you don't, one isn't going to do very well if you're in a large
That's amazing
state.
that they were willing to spend $80 for others, right? This isn't going to help them. This is going to help someone else.
Exactly, you can't,
Right.
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 So, and if somebody, we've had family members come and, they're terrified for their loved one that they know is suffering from substance use disorder, and I've made sure that they have 5, 6, 7 doses, because they should have one in their car, they should have one in their purse, they should have one in their house, they should have grandparents or friends that they know where their loved one travels, because you don't know when it may happen. The other thing is that people should never, if you know of somebody that is using any kind of drug that is not prescribed from a pharmacy, they should never use that alone. And even if that means calling someone and letting them know, because if someone uses a drug by themselves, there's nobody there to rescue them. So that's...
Well, thank you. I think we've all heard about it, but not really known. And so that is available if someone knows, that could be of use to them or their loved one.
There's a standing order. Dr. Larson has one here in our county, but it's state by state. Not every state in the United States has a standing order for Narcan or naloxone, but our state does, and many other states. So you do not need a prescription. You can just go and ask the pharmacy and say, I want Narcan. If they ask you for a prescription, you say, well, I want to use the standing order that our state has, because we have one. And then you find out whether, if you have insurance, it may cost you, it may not.
Sure. And again, I have Lauren Whickerath with me. She is the harm reduction specialist at Kidatas County Health, and we are discussing Ellensburg's recognition of International Overdose Day that is occurring tomorrow, 1 to 4, at the United Methodist Church. As Lauren has made clear, it is open to the public, everyone, so whether you've been touched by substance abuse disorder or not, you are welcome to come. We should all become educated about this. The more you know, the better you are.
Yes, and a lot of hands have done, a lot of agencies have come together to make this possible. Community Health of Central Washington, Merit, KDH, Gerald's.
So, is there anything else? I know you had provided us with the medical disposal sites,
Yes.
which I think is very important.
Yes.
Obviously, if we get rid of our prescriptions, they're not available for other people to do things they shouldn't do with.
Right. So 2.5 years ago, there were only 2 sites where 2 or 3 that you could, the sheriff's office and I don't remember the other. Now we have Rite Aid and both Cleveland and Ellensburg Safeways. We have Full Health Pharmacy, the Kidatas Police Department. I said Rite Aid, Community Health of Central Washington. Usually these are medication. They kind of look like a mailbox, and you bring in your medication and you so this is what you can do when you want to clean out your medication cabinet, if you have one, or wherever you store your medications. If you've taken an antibiotic or a pain medication or anything that is not something that, like a Tylenol, that you would want to keep around, or if something is expired, you should get it out of your house and to a safe place for disposal. If things get flushed or put in the garbage, they can sometimes make their way back into, especially worse, a big agricultural community.
Yeah,
and I'm sure that for many things that can be safe, and but if what is recommended is to bring it to a medication disposal site. When you have kids or pets, you just don't want them to accidentally ingest something. Might be safe in a dose of 1 pill, but if they swallow the whole bottle of whatever is left, or combine things, it's not going to be.
And we'll find a way to share this any way we can. And the same with the flyer for tomorrow. America will figure out something brilliant, no doubt. America, is there anyone who has any questions? We're glad to answer questions. We appreciate you joining us. Again, my name is Rolf. We're coming to you live from beautiful Ellensburg, Washington on a rodeo week. But before we're going to get to rodeo, there is the International Overdose Awareness Day tomorrow. Was there another thing you wanted to share? I know you had a brochure out.
This just got updated, and it's a brochure with the substance use disorder and also the medication disposal sites all in one spot. So this is our long list of 10 sites for medication disposal sites boxes, and then this is what is an overdose, and what is naloxone or Narcan, and then where can I get it. There's actually a website. It's phra.org/mail order naloxone. And I tested this. You go to this website, you give them your address, they will mail you some Narcan. So there's lots of different ways to
get and we'll share that again in the comments.
And then
we'll take care of that.
We've got just some amazing resources for people that are battling substance use disorder. And some of these are just really fresh to our community. We have a Peer Navigator, Recovery Navigator program that's being handled through Merit. The Kidatas County Recovery Center organization is just a vibrant community that's doing great things, and Community Health of Central Washington, KDH, just some great resources. But this is just kind of all in one.
And that'll of course be here tomorrow, and we will find a way to get some available here at the store. Wonderful. Well, thank you so much. We appreciate you, and thank you for what you do. Thank you.
Well, I appreciate being able to share it. We hope everybody can come out.
I think we then can go. Thank you, everyone. We hope to see you tomorrow at the event. Be safe.